I'm Mr Sudhir Rao. I'm a consultant orthopaedic surgeon. I work in the National Health Service as well as in the private sector. I specialize in knee surgery, hip surgery and shoulder surgery. I'm often asked, why does my knee hurt? The cause of knee pain can be hugely different depending on the age of the person that presents with the knee pain. Children present with knee pain is a part of their growing process, but one has got to be careful to assess other joints as well, as sometimes referred pain can also present in the knee. But in the older patients, we tend to see knee pain secondary to either wear and tear of either one part of the knee or different parts of the knee joint. So there is a huge range of presentation depending on the age group. When should you see your doctor about your knee pain? Immediately after injury, obviously the important thing is to remember to do the things like rest, ice, compression, elevation, see if the knee settles down within a few days. But if the pain persists and it becomes a recurrent factor within a week or two, it's terribly important to seek help either by a physiotherapist or by a doctor. Is surgery the main treatment for knee pain? I would say no. It's terribly important for us to go through the process of establishing a proper diagnosis of the knee problem. It might involve investigations such as x-rays, scans, etc. But surgery is the last resort as far as the knee treatment is concerned for your problems with the knee. Initially, you try and establish the diagnosis and see if you respond to non-surgical treatments. That might include very simple things like wearing a knee support, going for physiotherapy, doing exercises, and if all of those don't work, then we might consider surgical treatment. Recovery time after knee surgery is of importance, because then you can plan your operation, and it largely depends on, I would say there are about 3 groups of patients. There are surgical cases that are done as a single day operation. You go home the same day, you can put full weight on the leg, and you probably need a week or 2 at the most off from work, and it takes about 6 weeks for the tissues to heal after the knee operation. The second group is the intermediate level cases that we do, such as ligament operations after knee surgery, where the recovery is a bit lengthier. During this time, you're not immobile at any stage. The third group, which involves replacement surgery, that group is often the one that takes longer to recover. And again, in this group too, you're mobile right from the next day after the operation. Your hospital stay is usually about 2 to 3 days at the most, but you're allowed to put full weight, walk about, and it takes about 2 weeks for the wounds to heal. And the initial 6 weeks, please reserve for recovery after the operation, and the 6 weeks is so that you can get the best chance of recovery after a major operation.